Many of the patients that come to see me are affected by visually significant cataract or significant refractive error. One of the great privileges of being an eye surgeon is being able to either enhance or maintain someone's quality of life. The EQ Workplace is a fully automated workflow, so you have seamless integration from preoperative diagnostic assessment, preoperative surgical planning and lens selection, intraoperative surgical treatment, and postoperative follow-up care. The EQ Workplace connects both the IOL Master, integrates it into Forum and Callisto Eye. We're able to collate all that information in a fully automated system with pre-populated data. Actually reduces a lot of bureaucracy, a lot of paperwork, a lot of stress, and makes us far more efficient. And what I do is I do the surgical planning the day I see my patient, at the end of the consultation after I've discussed the plan with them. We're able to access the information in any part of the hospital, and any member of the team has access to this information and also is able to release it for the day of the surgery. This seamless integration without manual data entry increases safety, reduces the need for extra safety checks all the time, and actually reduces a lot of stress for the whole team.
Well, the integration of the data in diagnostics together with the calculation and the ordering of the lenses has certainly simplified our processes in the clinic. We no longer need to print out scans, biometries, or lens calculation forms for the consultants to complete. So I'm even now more confident that we're not introducing any manual data entry, that the processes are safe and secure.
What you want to look at is the risk of a never event while increasing your productivity and maintaining accuracy and precision. And that's where really EQ Workplace comes into its own. That comfort actually transfers itself to the environment, to the atmosphere, and also to the patient on the day of surgery. It makes them more relaxed as well. EQ Workplace has really increased my productivity significantly. We're able to do 35, 38 patients, an increase of about 25% now on a surgical day, while not compromising on safety and also not rushing. The software does not end once you have performed the surgery. What is great is it has a lens constant optimization function. Without having to enter a lot of data and performing the analysis ourselves, you can do this all in one step. We're just completing the cycle. It's actually really revolutionized my cataract workflow, not just for myself, but my surgical colleagues as well, and for the rest of my team. We're able to treat our patients just as well, but more accurately, more efficiently, and in greater numbers. And that is the most important thing about it.